Welcome back to my channel. This is your friend. Let's talk about the surprising fact about diabetes you have not heard about. Did you know that sugar is not the main culprit behind diabetes? There are many myths about diabetes that you should stop believing right now. You understand? The surprising fact might change how you think about the condition. Number one, sugar does not cause diabetes. Some people believe it's sugar that causes it. One of the most common myths surrounding diabetes is that consuming too much sugar directly causes the disease. But this is not completely true. Number two, gestational diabetes does not always cause diabetes in your baby. Maybe you are pregnant you are diabetic during pregnancy, does not mean that your baby will have it. Gestational diabetes occurs during pregnancy when the body of a woman cannot produce enough insulin, leading to high blood sugar. While it can cause various complications such as preterm birth, such as high birth weight, or low blood sugar in the newborn, it does not always mean that the baby will develop diabetes later in life. In fact, many women with gestational diabetes go on to have a healthy pregnancies and healthy children. And the majority of blood sugar levels in women also normalize after childbirth most of the times. However, it is important for women who have gestational diabetes to monitor their health, as they are at higher risk of developing type 2 diabetes later in life. Number three, people with diabetes can enjoy sweet. Common misconception is that people with diabetes they must not they must completely as in avoid sweet things, but this is not necessarily true, because when it comes to consuming sweet and dessert with diabetes, moderation is the key. You have to moderate, controlling your portion. Sweet contains carbohydrates known to increase our blood glucose levels, which is normal. So you need to keep a check on your carbohydrate intake and balance them with their overall meal plan. Eating small portions, choosing lower carb alternatives, and pairing sugary food with fiber, protein, or healthy fat can also help to reduce blood sugar hikes. Honey is not, some people say honey is not healthy sugar alternative to the diabetes. They are often seen as healthier alternatives to white sugar, but they may not be the ideal for people with diabetes. Why? Because they contain small amount of vitamins and minerals. Both are high in carbohydrates and can do what? Can significantly raise blood sugar levels. And we have heard that it has high glycemic index, similar to regular sugar. While honey, though lower in sugar, can still cause blood sugar spikes. So people with diabetes should carefully monitor all carbohydrate-rich foods, including natural sugars like honey, jaggery, to better manage their conditions. Number five, the some say diabetes can affect your emotional and mental health. Living with diabetes can be mentally and emotionally challenging and draining. It has been seen that people with diabetes are more prone to anxiety, depression, and stress due to constant blood sugar monitoring, dietary changes, and concerns about possible complications. Additionally, fluctuating blood sugar level can sometimes affect your mood, energy, and of course your focus and concentration, leading to what is often referred to as diabetes distress. So therefore, it is important that if you are facing a serious mental health problem, you seek support, whether from a friend, from a support group, from family members, or a mental health expert. Diabetes can affect your skin health. People with diabetes are more susceptible to skin conditions such as infections, dry skin, and poor wound healing. Eating more frequent meals does not help. Many people with diabetes are advised to eat small, frequent meals to keep blood sugar at bay and stable. But this is a misconception. The fact is that they should follow a time-restricted eating pattern. If you have learned one or two things, kindly follow me and subscribe to my channel. See you in the